The pump has two main parts.
The parts of a pump for intrathecal delivery systems for medications include the pump itself and a very, very thin catheter, meaning a hollow tube that's inserted into the spine through which the medication flows from the pump.
One of the common questions you get is, how big is the intrathecal pump? And you can think of it as it fits in the palm of your hand.
It's about the size of a hockey puck. So imagine a hockey puck underneath an inch, maybe, I think it's an inch, underneath your skin.
Basically, you can think of it as like a container which holds the drug, and that's the drug that is then pushed through the catheter to your spinal canal.
Well, the programmer for the pump itself is external. In other words, the patient would go to see their physician or their implanter, and they would place a programmer over top of the pump, and they could change the frequency of the medication in regards to either a continuous infusion, meaning it's going at the same rate 24 hours a day, every single hour, or a bolus, which means essentially a booster that the patient may get over several minutes.
One of the nice things about intrathecal treatment is that you can adjust the dose. And so there's a way that we can communicate through your skin with a programmer. Basically, you can think of it almost like a radio, and that we communicate with the pump, and we're able to adjust the settings. And by adjusting those settings, we can determine how much drug you get.
The FDA-approved medications are baclofen, which is typically used for patients who have severe spasticity, or another term might be cramps. The other medication, which is an extract of sea snail venom, and is typically used for patients who have nerve-type pain. And the third FDA-approved medication is morphine.
It's important to remember when you have an intrathecal device that you are receiving, in many cases, a very strong medication, and that's an opioid. Opioids, whether they're taken by mouth or whether they're delivered by the pump, have side effects and concerns that you always need to be worried about.
Here are some questions you may want to ask. What device do you plan to implant? May I see one? What medication will it contain?